Have you ever had that nagging pain on the outside of your ankle? You know the one. You figured it's just a sprain, but weeks, maybe even months later, it's still there. It just won't go away. Well, if that sounds familiar, you are definitely not alone. And today, we're going to dig into what might really be going on. I mean, we've all been there, right? You roll your ankle, you do the whole RICE thing, rest, ice, compression, elevation, but that annoying ache on the outer edge just lingers. It's a super frustrating story, and more often than not, it points to a culprit that gets completely overlooked.
So just how often does it get overlooked? Get this, up to 40% of acute peroneal tendon injuries are misdiagnosed at first. And what do they get called? You guessed it, a simple ankle sprain. I mean, that is a huge number of people who might be walking around without the right diagnosis.
And look, this isn't just a hunch. It's a well-known issue in the medical community. As this review from 2020 points out, it's crucial for doctors to have a lower threshold for even considering these tendon issues. Basically, what they're saying is, if that ankle pain just hangs around, it's time for everyone, doctors and patients alike, to start looking a little deeper than a standard sprain.
All right, so to really crack this case, we've got to understand the key players involved. So let's meet your ankle's unsung heroes, the peroneal tendons. So take a look here. You can see these two tendons running right down the outside of your lower leg, and they tuck right behind that bony bump on your ankle. That's the fibula. Their job is absolutely vital for pretty much everything your ankle does.
There are two of them, the peroneus brevis and the peroneus longus. They have two main jobs. First, they help evert your foot. That's the motion of turning the sole of your foot outwards. But their most important role? They are dynamic stabilizers. They're constantly making tiny adjustments to keep you balanced and upright.
You know, a really great way to think about them is like guide ropes in a super smart pulley system. Studies show they are the very first muscles to fire when your ankle starts to roll inwards. They're like your body's own little lightning-fast first responders, contracting in an instant to pull your ankle back into line and stop a sprain before it happens. Pretty cool, right? So there are body's built-in protectors. But what happens when these crucial guide ropes actually become the source of the pain? Well, let's look at the three main ways these good tendons can go bad. All right, first up, you've got tendinitis or tenosynovitis. That's just a fancy way of saying inflammation, usually from overuse. Think running, dancing, that kind of repetitive stress. Next, and this one is a bit more dramatic, is subluxation or dislocation. This is when the tendons literally snap or pop out of the little groove they're supposed to sit in. And finally, you can get actual tears or splits within the tendon itself, often because of long-term wear and tear. This MRI gives us a perfect look at that inflammation. See all that bright white stuff? That's fluid building up around the tendons. It's a classic sign of tenosynovitis, and you can just tell by looking that those tendons are swollen and really irritated. And here, this diagram shows that dislocation perfectly. The tendons are supposed to be tucked neatly behind the bone, but look, they've slipped out. That little band of tissue that's meant to hold them in place has been damaged, so they're not secure anymore. This is what causes that painful snapping or popping sensation people often feel. So, with all these different potential culprits, how do clinicians actually figure out what's going on? It's all about following the clues to solve the peroneal puzzle.
The whole diagnostic process is kind of like detective work. It always starts with the patient's story. What happened? When did it start? What does it feel like? Then comes the physical exam, with specific tests to try and reproduce the pain. And finally, imaging, like X-rays and, more importantly, MRIs, can give a crystal clear picture of what's happening inside.
And sometimes you find a total smoking gun. This right here is called the Fleck sign. See that tiny little chip of bone on the X-ray? That's a piece that got ripped right off the fibula when the ligament holding the tendons in place tore away. Seeing this on an X-ray is a dead giveaway. It screams acute dislocation. Okay, now this is a really interesting one. It turns out some people have a tiny extra bone called an os peroneum that's actually embedded inside one of their tendons. On the left, you see a normal one, no big deal. But look at the image on the right. The MRI shows that little bone is swollen and surrounded by fluid. This condition has a great name, painful os peroneum syndrome, or POPS, just another potential source of that mystery pain. So the mystery is solved, the diagnosis is in. Now what? What's the plan for recovery? Well, the good news is there are some very effective ways to get you back on your feet. Treatment usually goes down one of two main paths. The first stop, almost always, is conservative treatment. This is the first line of defense. The whole goal here is to calm things down, reduce the inflammation, and give the body a chance to heal on its own.
Now, if that doesn't do the trick, or if the injury is just too severe, then it's time to talk about surgical treatment to go in and fix the underlying problem.
So that conservative approach is a pretty straightforward step-by-step process. First, you've got to modify your activities and just rest. Then, anti-inflammatory drugs can help with the pain and swelling. Often, you'll need a period of immobility, maybe in a walking boot or even a cast, to really take the pressure off those tendons. And finally, physical therapy is absolutely key to safely get your strength and range of motion back.
Now, if those tendons just keep popping out of place, surgery can be a real game changer. One of the most common procedures is called a groove deepening. You can see it here. The surgeon literally carves a deeper channel in the bone. This creates a much more stable home for the tendons, so they can't slip out anymore.
And of course, there are other tools in the surgical toolbox, tailored to whatever the specific issue is. A tenosynovectomy is basically a clean-out procedure for all that inflamed tissue. If the tendon has tears in it, a surgeon can stitch it back together. And if that key ligament that holds everything in place is torn, well, they can repair that directly to make the whole system stable again.
So we come full circle, right back to our original question. The next time you, or maybe someone you know, is dealing with that stubborn pain on the outside of the ankle that just won't quit, remember those unsung heroes. And it's always worth asking, could that simple ankle sprain actually be hiding something more? Thanks for tuning in.